And if there isn't a connection, that raises an awful lot of questions. Our Dr. Mallika is here helping us get closer to some of the answers. Parents understandably worried when you hear about clusters of kids experiencing weakness in their arms and legs.
Absolutely. I mean, I'm a parent. I've got 3 little kids. Of course, parents are understandably worried. I mean, anytime you hear about children with significant illness, especially a cluster of cases, it makes people concerned. And to be honest, we don't know what's causing the weakness in the kids here at Children's Hospital or in Colorado. It could be enterovirus D68, but it could be something else. We do know that scientists all over the country are working hard to try to put these pieces together. In the meantime, parents need to remember that in the grand scheme of things, we're still talking about a very small number of children. So even if enterovirus D68 is responsible, out of the hundreds of children, if not thousands, that have been exposed to this virus, we're still talking about a very small number of kids with these neurological symptoms so far.
But the timing of this is also tricky because as parents, you're thinking about cold and flu season coming up. Is there particular concern or things that we should be doing now because of that?
So yeah, as you mentioned, it's the same advice that holds true because we are deep in the middle of a cold and flu season. Who would have thought at the end of September, right? But all of my kids have had colds so far. So of course, you want to wash your kids' hands frequently. You want to use hand sanitizers, have them cough into their elbows, avoid contact with other kids who are sick. And if your child has a bad cough or a fever, you really should keep them at home. And of course, if your child exhibits any evidence of muscle weakness, you want to call your pediatrician right away so that they can be treated and tested.
And you can get a flu shot now.
Oh, absolutely. And you should get a flu shot now.
Outstanding. Thank you, doctor.
You're welcome.